Maintenance Monday on a Tuesday here in Dr. Teague's office. A little beat up from the team series. Shoulder's giving me some problems. So Dr. Teague's going to work on it and talk to you guys about what he's doing.
All right, so one quick fix I'm going to do today on his shoulder. He's very limited into external rotation and internal rotation. He's really sore. So one quick fix I do on top of, the manual therapy is I take a voodoo band and I'm going to apply it on his shoulder. Typically go in a external rotation pattern, but whatever works for you. This one's a little sensitive when you get up close to the armpit.
So explain what you mean by external rotation.
So I'm going outward, so I'm trying to pull his arm into external rotation when I do it.
So the band's coming this
back,
way.
Yes. And when I come through, I'm going to take it lighter on the inside, and then once I get past the middle of the bicep, which is right here, I crank it on. All right? Every time I go up about a half length. So where I laid this one, then I'm going to go about half of that again. Nice and gentle on the inside. Crank it again. So I'm going to go all the way up. Crank it. Gentle. Crank it. All the way up the shoulder. And then I'm just going to tie it off at the top. This one doesn't look pretty. I use the red one because it's thicker. Whatever brand you use, just try to get a thicker one, because when you're doing the upper more proximal joints, it's harder to get those thin ones like this. Kind of folds over on itself. So I'm going to have him lay on his back now. What I'm going to do is take my hand closest to him. I'm going to let him bring him down like this. Can you see it? I'm going to press my hand into his pec. Try not to rip any armpit hair on this. I'm just going to press him into an external rotation position, and I'm going to bring his arm into internal rotation.
I feel no pain at any point during this movement. My hand's starting to tingle a little. You can feel the blood kind of cutting off the circulation a little, which is fine and normal. Obviously, we don't want to leave it on too long.
Nope. Under 2 minutes usually. I really want to get a shearing force against itself with the internal and external rotation against themselves right now. So just bring it in nice and slow. Do not take this very far. Communicate with the person that you're doing this to, because you can really injure their shoulder if you really crank down on this. So again, be very careful. Really press into that external rotation and just gently bring him in.
What I can do is just be here, and if he starts to go too far, just tap him. Don't wait till it hurts.
And I'm going to have him sit up. I take the band off.
Oh, yeah.
He's going to get nice pink. Stick your arm up. And then always retest afterwards to see if he has more range of motion. Got the external rotation better and internal better.
Before, after workout?
Before workout and after, both. This will definitely help clear up some of that shoulder gunk before you do, any overhead workout, or if you're sore from team series workout. So,
all right, see you next week.